You're here with Green Healthcare International. We're going to talk about ACH with Dr. Alan.
Well, I'm going to speak of something that a lot of people have heard of, and the sad thing is this is heard throughout, gyms and, this world of weightlifting. And the sad thing is that's not where it originated. They took on a hormone that we produce in our body, and they decided they were going to use it to make them stronger and, a lot more built. And that's not the idea of this. The origin of growth hormone is, well, as you hear it, growth. And it has to do with the regeneration of tissues. So getting this taboo aside, the idea is as you age, you decrease that production of these hormones, or this hormone in particular, growth hormone. And this hormone will help every tissue in the body regenerate, whether it be your skin, so you're going to look younger. You'll have thicker skin because as you age it gets thin, and so if you bump yourself you'll have bruising, so it prevents that. Bones become stronger, so they'll be more dense. You won't have all these risks for fracture as you age, especially in women. It will help on the other end that you do increase in muscle, but it is natural. Your natural production of muscle. Why? Because we're bringing you up to optimal physiological levels. Levels that your body is already used to. We're not going beyond those limits. And so you'll lose fat, which is good because with age, it's important you maintain muscle. As you look into geriatrics, you'll find out that the more muscle a person has, the longer or better chance they have of lifespan. The other thing that we need to talk about is that when we talk about gastrointestinal, the kidneys, when we start looking at the nervous system, the thymus gland. That's a gland that's below the thyroid, because the thyroid's up here. And the thymus gland is where all our immune systems it gets trained. And what happens is it starts to atrophy. But with the use of growth hormone, it starts to develop again, and it starts training your immune system to be optimal as if you were 18 again. So all these different things are important, and along with this, it helps with sleep, it helps lower cholesterol, triglycerides, it helps people to, in the end, coronary arteries will have less blockage. If you have myocardial problems, which is of the heart, it will help regenerate those tissues as well, and it will prolong your life. There was a medical study done by Stanford, and they found out that on chromosomes, which is the ones that hold your DNA, on the tips they have something called telomeres. And telomeres tell you that you have a maximum of 120 years to live, is what scientists have told us. And what they found is it will elongate those telomeres. So that means you'll have a chance, if you ever get that far, to have longer life than 120 years. And you'll have a better quality of life.
Doc, I'm 50. When should I have started this?
I'm 40 and I already started. And one might ask why? Well, if I look at my growth hormone levels, they were already starting to decline. And I want to prevent having any problems. And I am into sports and I love playing soccer. And this knee was problematic. I had been in a brace or a cast for almost a month and a half. And after about 15 years, it still wasn't the same. I got on growth hormone, and this knee sustains all the weight and impact that someone who's 18 has, because I play soccer twice a week for 2 hours each game. So that gives you an idea of how this knee does at 40 years of age. And well, I'm doing pretty much what all the pros are doing, in the sense that they're training. I don't have to train. I just get to play the sport, and I don't have any damage.
So I'm a little bit late in the game.
Not late. We can always say that you're better off than someone who started at the age of 70.
And is there a time frame that is ideal studies-wise, or?
There is no time frame study-wise. Through what I've learned throughout the years of applying this treatment is that anyone can have low growth hormone levels. It just depends on many different factors. Mainly it's age. So yes, as you age, that's the main factor. But I have found people who are in their 20s, they have low growth hormone. And as you've heard in stories and on the news, that there are children who lack it. And so if they don't use it, they will be in a lower standard of height. And the idea is that you get them right back up. And one of those is a soccer player called Messi that, you know, if anybody knows the soccer world, that is a famous player who needed it. In this case, this is helping us to maintain a better quality of life.
Okay. So what you're saying to me is that I can still do it now.
Yep.
And but how do you know how much you apply or you don't apply? You know, and I've heard things about the pen and the way it's. Can you tell me a little bit about what?
I sure can. The idea is that you know that this is something simple. So if you're afraid of needles,
I'm afraid of needles.
I'm going to tell you right now, when I show my patients the needles, they have to actually, if they have glasses, they have to put their glasses on because they can't see it. It's about the size of a hair, and it's about yay short. So if you look at your pinky and look at the fingernail, it's the length of that fingernail. Obviously, if we're talking about someone who's 7 foot, that'll be a different size pinky. But I'm saying in general, it's really short, and you put it in the fat like a diabetic, and it's simple. The other thing is that when you do this, you do have to do labs. I don't do what happens in the gym. In the gym, all these guys, they're trying to copy what the doctors do, and that's not correct. The idea is you go and do a baseline level. We got to see if you need it, and then I'll tell you what dose you need, and we'll be checking up and making sure that you're at the right level for all of this.
So there's no guessing here.
There is no guessing. Oh, we're precise.
And how long does it take to get that effect that we're looking for?
Everyone is different. So when we talk about humans, it's the same as saying, okay, we're going to do a surgery. Is everyone going to have the same outcome in looking at the scar, how fast it will heal, all those things? I have patients that within 3 days, they already start feeling changes. Others that take a week, others that take a month. But I can tell you this, all of them feel a change and difference in their life.
Okay, you know, Doc, thanks for taking the time to explain this.
Of course.
I think that those of you that don't know about SGH, you know what? I learned a lot today, but I'm sure there's a lot more.
Oh, there's plenty to know, and that's why if you guys ever write us or you call us, we're here to answer all those questions and doubts that you have. And if you come here to Costa Rica, you'll see the facility and you'll see that it's a great place to be. And on top of that, you'll see that we have wonderful reviews.
Well, thanks, Doc, for taking the time today to meet with us.
Of course.
Hopefully, we'll see you soon with some other subjects because we got a lot of subjects to cover. But thank you for taking the time today.
Of course.
Those of you who want to get some information about Dr. Alan's treatment, which is HGH, which I think we just touched a little bit, right?
Yep, sure did.
We just touched the tip of this. There'll be some follow-up videos in regards to that. Thank you. Pura vida.
Pura vida.